Hi, welcome to Thrive Personal Fitness. I'm Pamela Hernandez, your guide on the journey to health and fitness. And today I want to do part 2 of our discussion about diet pills. Last time we talked about diet pills, supplements, fat burners. Those things that you see advertised that are supposed to help boost your metabolism and help you burn more fat during your workouts. Well, today I want to talk about what I call the approved weight loss drugs group of pills. Those things that have gone through the FDA process and are deemed to help you lose weight. The thing with these pills are there's always a risk. And does the risk really outweigh the benefit? In most cases it doesn't. In fact, in my opinion, in all cases it doesn't. So let's talk about a few examples. We'll go back to the 90s first and talk about a drug combination called fen-phen. Fen-phen was actually a combination of 2 appetite suppressants that by themselves didn't do a whole lot, but doctors found when they prescribed them together, they helped patients lose a lot of weight. Well, that was the good side, I guess, but there was, of course, the risk. And they found that it was causing damage to people's heart valves as well as causing pulmonary hypertension. So the drug was pulled off the market due to quite a few deaths attributed to the use of fen-phen. There's another drug that you probably heard about more recently, which is Meridia. And Meridia works on the area of the brain that controls appetite. It helps increase the feeling of fullness, is how it helps people lose weight. And while it did have little benefits, it was actually causing an increase in heart attack and stroke. So Meridia was actually pulled off the market in 2009, actually early 2010, because it didn't work as well as they thought it would work, and it was causing an increased rate of death among users. Then there's a class of drugs that are the fat blockers. The most common one that you see, and you can get this over the counter on the shelf, is Ally. And what it does is, like the name says, it blocks the absorption of fat. So if it blocks the absorption of fat and those related calories, the idea is that you'll lose more weight. Now, of course, they tell you that you need to exercise and follow a certain diet. And using Ally, studies show you might lose an additional 3 to 5 pounds a year. But the problem is, if it's blocking fat, the fat's not getting digested, it has to go somewhere. It has to go through your digestive system and through the end results, which can cause a host of digestive issues, especially if you eat more fat than the 15 grams a meal that they recommend. So very urgent bowel movements, something that I'll delicately refer to as oily stool, some very unpleasant things that can happen when you use Ally, as well as the fact that since you're not absorbing fat, you're also not able to use fat-soluble vitamins as well. So there is a risk of being deficient in fat-soluble vitamins when you're using Ally. Again, the risk not worth the benefit. And that's how I feel about diet pills. To get the results you want, it really comes down to eating properly and getting in your exercise and putting in the hard work. So send me your questions. I love to answer them. If you'll send me an email, ask@thrivepersonalfitness.com, or you can post a question on our wall. Go to facebook.com/thrivepersonalfitness, or send me a tweet. Follow us on Twitter. Go to twitter.com/thrivefit. So thanks for listening today. Remember, every journey starts with the first step, and we'll talk again soon.
And we're rolling. So you guys ask.
You're a mess. You should not make me laugh.